All right, welcome into another episode of For Your Health, the podcast sponsored by Roane General Hospital. I am your host, Andrew Miller. Of course, as always, exciting to bring in new guests each and every week. And we're very happy to be joined by Leann Thomas, who is a nurse practitioner at the Family Medicine Center up at Roane General Medical Clinic. Leann has been at Roane General Hospital in the family practice for around 8 years. She's been active in medicine, though, for 25 years. On top of that, she is currently on active duty with the Air National Guard in West Virginia. Very accomplished lady here, and we want to talk about a few things with regards to that, Leann, but you are here to talk about women's health, and that's something that obviously is very important to you. Before we get into the topic of women's health, let's talk about, number one, thank you for coming.
Thank you for having me.
We do appreciate that. And number two, we see 8 years here at Roane General, but in medicine for 25 years. Obviously, this is something that you're passionate about. You don't work in this field if you're not passionate about medicine and about health. Where did it all begin for you? When can you pinpoint a time growing up that you thought that this was the path that you may want to take?
Definitely in high school was whenever I realized that nursing would be a good route, just to kind of help people. Kind of always had a heart to help people. So this gives me the opportunity to do that, and it's definitely been a good path through the years.
Where was high school?
Calhoun
County High School.
Yes.
I did not. Okay, so you are very familiar then with the area.
Yes.
I was going to give you all this information during this podcast. We're like, hey, there's places you can go see and do, but you're already from around the area. Okay, cool. So Calhoun County High School, and then obviously, as you say, you knew in high school that nursing was kind of a field that you wanted to go into. There are some real staffing shortages with nurses, even to this day. Was that the same when you came out of high school?
Yeah, I think it's always been a shortage for sure. It seems to be worse, I think, as the population ages and the need is there for sure. And I think in our rural areas, it's harder to recruit people to these areas if you're not from here or grown here. It's definitely a problem.
Yeah. And again, you said in the rural areas, that's something we're going to touch on with regards to women's health and why you're so interested in this. So you knew in high school that you wanted to become, you wanted to be in nursing in some form or fashion. Where did you go to college to get all of that training? Or did you go to college or did you go to a trade?
I actually started at the Roane Jackson Technical Center as an LPN and started. Roane General actually gave me my start and allowed me to work as a nursing assistant whenever I finished up LPN school, just to get that real life hands-on experience while I was training still. Started as an LPN, worked for a year, and then went back for my RN. Went to Hocking College for my ADN, and then I think that was in 2003 for my RN, and then went back for my BSN in 2009, realizing that my ultimate goal was to be a nurse practitioner.
Yeah. And there it is. A quick plug to the Roane Jackson Tech Center, folks. I'm telling you, there are multiple avenues to get to where you want to be. And obviously, the Tech Center is a perfect place to be for that stuff. So before we get into women's health, the Air National Guard, when did this start for you?
So I kind of always wanted to serve. My baby sister was in the Army National Guard, and I don't know, probably all through my life it was kind of a thought. And then after I got my nurse practitioner, I thought I could give back, a little more than what I had. It was kind of on my bucket list, like, oh, I want to do this before I'm too old. And ultimately went and talked to a recruiter, and it took over a year to get in, and I love it. It's very rewarding.
So you are active duty in the Air National Guard. So there are times that you could be pulled away from your job, correct?
Yes, sir. Mm-hmm.
Just amazing stuff, amazing stuff. I want to go back as we introduce women's health to the statement that you mentioned that it's very hard to recruit nurses and hard to recruit people to rural areas. And one of the reasons that you're so interested and passionate about women's health, because in this rural area, there are not a whole lot of resources, number one,
Sure.
for women's health. And so that's where you kind of come in and you look around and you see the landscape. One thing that's great about Roane General Hospital right now is this Prescription for Your Health program where we are attacking so many different avenues. Women's health is a specific thing, though. Let's talk about some of when we talk women's health, we're not just talking about exercise. We're talking about reproductive health, menopause, heart disease, things like that. What are some of, I mean, if I left anything out there as far as women's health is concerned, what are some of the things that you're seeing in these rural areas that are major issues of concern when it comes to women's health?
I think it's just rural area and, socioeconomically, a lot of our population they don't have the access or the way to transport to these other areas where these specialists reside. Because we're looking at an hour and a half to some of these areas where these specialists are. I think that is one of the biggest hardships here as far as getting care for women's health especially.
What are some of the services
Here
that we do have? Obviously, we're limited. And again, you work at a hospital that's, I guess, constantly evolving and trying to localize more things. There's so many different things and specialists that you can have for different types of health issues. And Roane General is always trying to get more people involved and try to get these traveling people to come in. But what are some of the things when it comes to women's health specifically that you do see that Roane General in general and specifically in our rural areas that they do have access to?
Here we do Prescription for Your Health program, which is a wonderful thing, not just for women's health, but just for health in general. We do annual screenings here for cervical cancer screenings like pap smears, things like that. Mammograms, we have a 3D mammography machine that will allow people to be screened for breast cancer. DEXA scan for screening for osteoporosis. We do reproductive health as far as offer birth control. I personally am trained and able to provide Nexplanon to this area, as well as the traditional kinds of birth controls like the oral contraceptives, patches, and just there's an array of products available. But as far as devices, we can do the 3-year Nexplanon. I have been trained to do IUDs, but have not had enough population to be competent in that so far. So I don't want to do that until I have the competency. So hopefully in the future, that is something that we can offer here at Roane General as well.
One thing I heard you mention was with the osteoporosis. We had a guest on. I can't remember who the guest was that was talking about osteoporosis. Laura Smith, provider. Yes. And of course, I'm not very smart when it comes to any of that stuff. So she took me through. And when you mentioned menopause and what that does, can we visit that real quick? What is the situation with menopause and osteoporosis? Why are those two things linked together?
Well, it's the lack of hormones. As we age and those hormones go away, it just allows the bones to thin and break down. So it can be a natural product of aging. And it's just something that we want to, with anything, with health, women's health, identifying, problems and trying to prevent those issues down the road is one of the big things that we do. So prevention truly is key.
And we were talking about women's health, and we said it's not just in forms of exercises, but that is important. Exercise is very important for women, just as important for anybody. What are some of the biggest topics that you're thinking about when you're trying to attack women's health in general? Is it just simply the reproductive? Is the menopause? Are there other many topics?
Yes,
bring them
for
to
sure.
me. Then.
So, mental health for sure. It's very important. Our psyche affects all parts of our body, right? So our physical health can be affected by mental health. So we want to, disease processes. We see diabetes here, and hypertension and things like that, that also just overall affects people. So generalized health, mental health, you just try to see the body as a whole and a person as a whole and try to take care of all the aspects that we can.
One of the things that, as I was preparing for this, did not understand. I'm glad that we have Kim Mertz, who is involved with this. I didn't realize, because I'm not in this medical field or anything like that heart disease in women is one of the leading causes of death. Can you touch on that a little bit? That's not something that I would have thought of. I mean, I know heart disease in general, specifically in West Virginia and in rural areas, but I didn't know that women specifically, that's an issue.
So that goes into the hormones involved as well with aging, and as those hormones kind of deplete, your heart is affected, and heart disease goes right along with that lack of hormone as well as the osteoporosis and all those other factors.
Well, what are some of the things that can be done about that? If we're talking about attacking these problems, if someone comes to you, what are some things what are suggestions or actual medical things that can be done to help this stuff?
Prevention is number one for sure. So we just kind of want to nip it before it happens. So a good heart healthy diet, a good 30 minutes of activity a day, hydrate. For menopausal ladies, hormone replacement therapy is a good idea, just to kind of offset that lack of hormone and these problems that come down the road.
Let's say someone did not prevent it. Let's say someone comes into the medical clinic and they, for whatever reason, have not done that, and they are now dealing with some issues, and they're dealing with, let's say, some heart problems. Just for one example, what are some things that you guys are going to do up there that are going to try to counter that or mitigate those problems for people?
So we would treat, obviously, the problems that would come from that. There are medications, and we do have cardiology here on staff that are super helpful, and just a great bunch of physicians, and there's a nurse practitioner and a PA as well in that department, and super helpful to get our patients in quickly, and they don't have to travel, to go see that specialist either. Truly, if it's not prevented and we're dealing with the problems, then we treat the problems as they come, to try to prevent further damage down the road.
I assume that you work at the medical clinic, and you said there's a specific cardiology department who has practitioners there. I can only assume that the communication with everyone is very, very good in this situation, because it has to be a holistic approach, obviously, to treat these people. But on top of that, now we have something that you guys can do up there, in that you guys can prescribe the prescription for your health program. Tell me about what that has done for you guys up there to be able to help treat some of this stuff with your patients.
Oh, it's helpful. The gym is here, and they have access to the gym, which allows, during the poor weather in the wintertime or whenever it's super hot outside, they can still get that activity. The gym is included in that membership. It also allows them to get their labs at a discounted rate. So I think that makes people more willing to get those done. And it just kind of is more, it's a check and balance kind of. It's not just on our shoulders. We have a team approach, right? Yeah. So the patients have more people in their corner, kind of encouraging them and cheering them on, to do better and make better choices and be active and healthy.
Well, so you're talking about family medicine. This is where you work. So you're seeing all sorts of patients, be it yearly checkups or preventing something, or post facto dealing with something. Even if somebody is dealing with it, if it's not preventative, why is exercise and nutrition so unbelievably important when we're talking about women's health? Obviously, it's important for everybody. You talked about hormones. You talked about menopause. When we talk about those things, let's go back to when they're young women and how important it is to develop a habit for exercise and nutrition, and why that is important as menopause starts to show up, and then why it is important in older age. Why is it so important for women to get those healthy habits begun?
Prevention, 100%. Weight-bearing exercise is one of the best things you can do to prevent osteoporosis, for sure. And then, of course, heart-healthy diet, the good nutrition. It's good for prevention of heart disease and those things that are truly a huge risk down the road.
You know, I was thinking about the exercise portion of this, and we've had many people in the seat that you're in right now talking about the reason you try to develop healthy habits early is, you want to live the best quality of life you possibly can as you age, because that's one thing none of us are going to outrun.
Sure.
So balance, coordination, things like that. Are those things that you guys can talk about up at the family medicine?
Absolutely.
Okay, so let's talk about that then. You guys aren't exactly supposed to be, fitness trainers or anything like that, but you are able to, I assume you're able to give people some general understanding of what they need to do to help with these things that are happening. If someone comes into you and has zero clue about what's going on, what are some things that you would tell somebody who is maybe needing to pick up some coordination, some balance, some strength training, core acts, whatever it may be? What are some of the things that you explain to these people who are maybe not understanding this?
Just the importance, like with the balance and the risk of falls, that strength is so important. We also, we have physical therapy here that we definitely get on board whenever we're seeing those sorts of things where people are getting weaker or having falls within their home. Just using the resources that we have for sure. It's crazy with exercise. Like, you don't have to run a marathon. You don't have to run 2 miles a day. Like, just that 30 minutes of activity a day, of getting that heart rate up, something that's outside of, walking across your living room to, do your normal activity or walk into the bathroom, just something to get that heart rate up for that activity. It doesn't have to be anything crazy, just to keep the strength up. I tell patients all the time, if you don't use it, you lose it.
Mm-hmm.
And it doesn't take very long at all to lose muscle mass and, the strength that you have.
Well, you talk about women specifically, and you've mentioned hormones a lot as they age, and let's say once menopause hits and as they age, does that make it more difficult for women to maintain strength and maintain muscle stability, anything like that? Is that an issue at all?
It definitely changes the way we gain weight and are able to lose weight. Changes, I feel like metabolism. It's definitely changes a lot of things.
Is there, when it comes to women, is there anything, I don't mean to go like the prescription route, but are there any medicines or anything like that can help counteract hormone? This is going to sound stupid. Hormone loss? Is it just
So I touched on the hormone replacement therapy. There are certain things that we can give to kind of replace those hormones. So just to help with the symptoms of menopause, my brain has not working.
For people who don't know, you're working right now. You're currently covering for other human beings.
Yes.
We're gonna keep you as long as possible.
Yes, for sure. The vasomotor symptoms that come along with menopause, right? Like the hot flashes and the lack of sleep and just the brain fog and all the things that people don't really talk about, that affect women after their hormones are depleted. Hormone replacement therapy can definitely help with that. Of course, if you have a risk of breast cancer, there are certain things that would disqualify you from that. So whenever that happens, there are other medications that we can give to kind of counteract those, the lack of sleep and the hot flashes and things like that. So there are options to kind of make it a little bit more tolerable. It's difficult. It's very difficult. Yeah.
You're counteracting.
A lot of people really, really struggle. And I feel like there's definitely education that, for the patients as well as the providers, myself included, we have a lot to learn. Menopause is not a disease.
It's just something that
It is
that happens.
Yep.
You touched on mental health. Is there any connection between going through menopause and the hormone loss and hormone changes, all that stuff? And do you see any issues with like mental health when that happens or even after that takes place? Is that something that is forefront in your mind when it comes to that? Because we do have some things that can be done here to help with that a little bit. Is that something that you guys even see, or is that something you just notice?
Oh, yeah. I mean, one of the big things people complain about is like anxiety. And whenever you don't sleep, it definitely affects your life.
I can attest to that.
Yeah. So, I mean, there's just a lot of aspects of hormone changes and menopause that truly affects your whole body, like your mental and physical health. And
So we've touched on menopause a good bit. We've touched on some of the heart disease issues and trying to prevent things like that. And then once things are happening, trying to react to that with exercise, proper nutrition, all that stuff. Let's go back to premenopause stuff. Let's go to reproductive health for women. You did talk about some of the things that you're obviously capable of doing. Why is it? I'm going to give I'm going in the weeds now, just so you know. Let's say
I didn't put on my bug spray. I'm not ready for the weeds.
let's say a young couple is wanting to have children, wanting to have kids. What are some things? Exercise and nutrition is probably a good idea for someone who is trying to do that. I've seen things where people may not be able to have kids, or it may be a dangerous situation if they're really unhealthy or things like that. Is there a connection to that, or am I just reading that weird?
You want to be in your best possible health, right? To be pregnant, you're gonna put yourself. I mean, pregnancy can be risky anyway. So, if you're overweight and have diabetes, and
it's not even so much. Well, I mean, it's tough to do, but if it is done, it's dangerous enough for you or the potential the child who is
sure.
So it gets more risky the more risk factors you may have.
Yeah. So, I mean, we know with obesity, we get you can have some hypertension and type 2 diabetes and things like that, which is just going to make the pregnancy riskier. So I think if you are doing your best to make good choices and be the healthiest that you can be, it's going to be better for the mother and the baby ultimately.
And obviously trying to get pregnant, if you're a young couple or if you're a couple, whatever it may be, is stressful. And that goes back to stressors and mental health and things like that. Obviously we have some things here at Roane General Hospital, but people may want to find outside assistance for that. But is it incredibly important for young women who may be pregnant, to make sure that their mental health is as on point as possibly can be?
Absolutely. Hormones truly, like menopausal during pregnancy, through young adult, whenever you're first going into puberty and things, hormones affect everything, right? Mental health, and it's definitely important. And we know exercise improves mental health. We get those endorphins that help with depression and anxiety. So we do find whenever people exercise and are active that usually their mental health is in better condition as well.
Not to put you on the spot or anything, but postpartum symptoms and postpartum stuff when it comes to childbirth for women. I know postpartum depression is still a huge issue. You're going to solve all this right now, by the way, during the podcast.
I wish, and I'm sure that the mother suffering with this would wish as well.
Obviously, that's a part of mental health, and we're talking about women's health, and that's another big thing. What would you suggest for someone who may be having problems or having some symptoms, or maybe just come to you and say, hey, I'm having some problems
Absolutely. It's not anything that people can control. It's just something that happens, and identifying that and just talking with somebody sometimes is helpful. Sometimes, medication is helpful. There's no shame in that. It's not something, like I said, that is anybody's fault. It's just with those imbalances and things kind of, getting back into order after a huge, change on your body. Definitely, I think identifying it and having somebody that you can talk to and just having a provider, that you feel comfortable telling how you're feeling.
I think it's number one is comfort. It is getting comfortable with that and erasing whatever stigma may be there when it comes to that. You're not alone if you are suffering from postpartum depression. That's a common thing for women. So, and of course, in that situation, they may think I'm the only one dealing with this. So it is good to have someone to talk to, be it a nurse practitioner, be it anybody. Number one, talk to somebody versus nobody. So there's a lot of different things involved in women's health that is not just exercise and nutrition based, although that is a pretty good basis for a lot of this stuff. Many of the things that you've talked about, so yeah, it can be improved by exercise. You said 30 minutes a day of some exercise and some good nutrition, eating better. I mean, let's just say we're not reinventing the wheel.
Sure.
It's simple, but it's hard in that it's not incredibly complicated to understand it, but it's incredibly hard to implement it consistently in your life. And with the ability that you guys have to prescribe the Prescription for Your Health program is a big deal. That's something you've worked here for 8 years. You've been in the medical field for 25. Is this something that you have seen anywhere else when it comes to prescribing something as whole hog as this?
Right. No, not that I've seen. I'm very proud to be part of Roane General and the things that we're implementing to try to help the patients overall.
Yeah. Number one is something that we just keep saying this is like a pilot program, and it's such an interesting thing. I've said to Doug Bentz a couple of times, it says it feels like you're cutting off your nose to spite your face. As a hospital, hospitals have always been reactive. They've always treated. They haven't been so much preventative. And what's happening here is we're trying to prevent patients.
Right.
Which is an odd thing to do. That's fine. It's a very aggressive goal. As you said, you grew up in Calhoun County. I grew up in Roane County. We know, we've said it many times, the numbers are what they are around here. But for Roane General Hospital and everybody in this program, that's not good enough. Everybody's saying, no, well, we don't want those numbers to be like they are anymore. We're not just going to accept that that's the case. And you guys play a big part in that because you are family doctors, family nurse practitioners. You're the ones that are going to see not just people who are older age or people who maybe have some pre-existing conditions. You're going to see the kids. You're going to see the teenagers. And you guys can get them early, right?
That's right. Get them started early with good habits. I mean, truly and honestly, it all comes with one habit at a time, one day at a time, one decision at a time, and just making good choices and trying to avoid high-risk behaviors.
So, to wrap things up here today, let's give a couple of recommendations for those healthy behaviors when it comes to maybe exercise, nutrition, mental health. I like it. She brought notes too.
I did,
That's good
and
stuff.
I didn't look at them at all. Sorry, I slammed the table.
See, here's what happens: is I get into the weeds and I lose track of what we're supposed to be doing. So,
right, I'm bad about the weeds too. Get off on tangents. Definitely the heart healthy diet that we talked about. At least 30 minutes of activity a day, if at all possible. And for the population that has never exercised or is just getting started, like little by little. Like I said, one choice at a time, one healthy habit at a time. It's just do what you can, move, just get up and move. Make sure you're hydrating. We usually recommend half your body weight in ounces of water. So for a 100-pound person, we recommend 50 ounces of water a day just to stay hydrated. And And then, like I said, just avoid those high-risk behaviors, alcohol in moderation, avoid tobacco products if at all possible.
How about sleep?
Oh, sleep's so important. It's so
I
important.
think it's underrated.
It is underrated.
Not to hijack your finish here, but I think that sleep is very slept upon.
Yes, for sure. And it truly, and I think we touched on that, like sleep affects every aspect of your health, mental health, clarity, and, that brain fogginess, and just your function in general and overall health. I mean, we see people with sleep apnea that, is not, they might be sleeping, but not getting good quality sleep.
Yeah.
And it affects your heart and your kidneys. And sleep is very underrated.
Yeah. And that goes for everybody. But again, we've been talking here with Leann Thomas, who is very interested in getting the word out about specifically women's health and what there are, what resources there are here, what resources may be lacking that you are looking to talk with people about. So if anybody is interested, all they got to do is call the medical clinic and get an appointment set up with you guys.
Yes,
and they can start the process of talking through these issues with you specifically.
Always happy to help. That's
Absolutely.
what we're here for.
100%. Leann Thomas, nurse practitioner at the Medical Clinic for Family Medicine. But we're talking women here. Thank you very much, Leann.
Thank you.